What we're trying to do is we're actually trying to think, what do missed appointments mean? What does this pattern of missingness mean? And what can we pull in from other literature areas that will tell us more about it and help us think about what the interventions might look like?
We're using a model called the Candidacy framework.
What it was originally designed to do was to understand inequalities in the access to services and the utilisation of services once you have accessed them.
So it's this idea that there are various points throughout somebody's journey to a service and also through a service that are potential areas where barriers might come up and blockers might happen.
It helps us to understand structural factors. It helps us to understand the way in which different policy domains come together.
It focuses on the interaction between people and services. So we're not talking exclusively about problems for patients or potential patients, and we're not talking solely about services, but we're talking about what happens when those two things meet. But the focus for us is kind of in the patient experience because we're talking about the outcomes for patients. If you think about your problem as this is an issue for services, it costs money, then your interventions are designed to save money or get money back. If your problem is patients can't make it to their appointments, they're getting more unwell, they're feeling more excluded from services, then your priority for your interventions is to tackle that.
Work Package 1 is an attempt to understand what the literature tells us about missingness.
You look at what's been written and you kind of look at how it's been written, but you also take quite a critical view of what's not been written, what perspectives aren't there.
What we're having to do is look across literatures to do with different kinds of vulnerabilities. There isn't a defined body of literature that talks to us about why people miss multiple appointments. Work Package 2 is where we fill in some of the gaps by talking to experts by experience, and we also talk to professionals who have roles in supporting vulnerable populations. And we try to understand what creates the conditions for missingness. The third work package, we continue to refine our understanding by taking our findings back to the kinds of people that we've spoken to in Work Package 2 to try and co-produce a set of interventions.
I would hope that we come out of it with a really good understanding of what is actually going on that results in people missing appointments, and that should hopefully feed into policy, practice, innovations, changes.
You know, even by taking part in this research, particularly professionals, I think they'll be going away thinking, right, okay, let's think about this. The research papers that we publish, we hope will have impacts in terms of other researchers thinking about it, but also we hope policy people will pick up on it. We are trying to use innovative methods that will help people understand what the evidence tells us and therefore help people think about what could be done in their setting.